Scott here. The video I've got today is a little bit different. It's not a DIY video because unfortunately I'm not capable of do-it-yourself surgery yet, although I wouldn't mind having a crack at it. The orthopaedic surgeons use the same sort of tools that I have in my man cave here. But what's happened is I had a high-speed fall on my track bike here on a practice day on the 2nd of November. I ended up with a fractured distal tibia, so that's the end of the tibia on the ankle, and I also ended up with a fractured radius at the end of the radius bone where it joins the wrist. So basically I had a broken ankle and a broken wrist. Now the fractures were such that I required orthopaedic surgery. I required ORIF surgery. That stands for Open Reduction Internal Fixation. Now it's quite a daunting thought, so I thought I'd make a video of my experiences prior to the operation, and then immediately after the operation, and then the various stages that you have to go through. This particular video today is just about the ankle. So I found it a very frustrating experience trying to get decent information. The surgeons are so busy, they're sort of in and out, and you're trying to get decent information as to what's installed for you, what the various stages are, and it's very difficult to pin the surgeons down and actually get a straight answer from them. And you'll get different information from different people, so there's a lot of misinformation around, from the nursing staff and from the staff in the surgeon's office. So I thought I'd just put a video together about the foot, or the ankle in this case, just around what I've been through. So if you end up in the same situation and you don't know what's going to happen to you, maybe what I've been through will give you some insight as to what's installed for you. It happened on a Saturday morning. I was able to get myself home, so I was able to drive home with a broken wrist and a broken foot. I spent the Saturday afternoon and the Sunday just with my right foot elevated and using rest, ice, bit of compression bandaging and elevation. So I was just trying to get the swelling down. I had a lot of bruising and swelling on the leg or on the foot. I'm just interrupting the video for a moment to show you some photographs. So there's two photos there of my foot that were taken the day after the accident. So they were taken on the Sunday. So I just had to really lay around with the foot elevated and putting ice packs on it. That's all I could do until I could get to see the local sports physiotherapist on the Monday morning. We went down to the local pharmacy and hired some crutches so I could get around. And I made the appointment first thing Monday morning at the physiotherapist. I got down there and saw him. We assumed that it wasn't broken at that point. He did some mobilising of the joint, he did some ultrasound, he then strapped it up, sent me home, said come back first thing in the morning, which I did. Did some more ultrasound, some more sort of movement. I still couldn't bear any weight. Said I think this is probably broken. So he then referred me immediately to a sports doctor. So I was able to get in to see him almost straight away. He then sent me off for an X-ray. The X-ray confirmed it was broken. He then immediately made a tentative booking for me to have surgery on the Thursday with a specialised orthopaedic surgeon who only does knees and feet. So he then organised a CT scan because he said the orthopaedic surgeon will need that. So you can see the photo of the CT scan there. That came back and really shows in fantastic clarity the fractures. So I had one sort of quite large fracture, longitudinal fracture that goes from the front straight through the back and crushed a bit of the bone on the front there at the joint, and there were three other longitudinal fractures, and I think someone told me that they call them a parachutist's fracture because they happen because the foot's been jammed upwards into the tibia, so it's almost like hitting it with a log splitter. And the only way to fix those is surgery to screw it all back together, because you know, as soon as you put any weight on it, just forces joint fluid up into the split and just prices it apart again. So that's the only option, was the surgery. Yeah, so my job prior to the operation that was now scheduled for the 14th of November was to try to get the swelling down as much as I could on the right foot. So for the first 3 days after the accident, so that was the Sunday, Monday, Tuesday, it was elevation and ice, and my wife was bandaging it each evening to put a bit of compression on it while I was sleeping. After 3 days had passed, we then moved on to the alternate iced water and hot water bathing. We were doing that about 3 or 4 times a day, every day up to the morning of admission to the hospital. So what that entails is you put the foot in iced water for 2 minutes and then you alternate, take it out, put it into hot water for 2 minutes, and back into the ice water for 2 minutes, and so on. 10 minutes all up. That worked really, really well. It got the swelling under control, and it came down quite markedly over that sort of 1 week period. So I checked into the hospital on the Thursday, the 14th of November. My check-in time was 1 p.m. You spend a lot of time sitting around waiting. I finally was operated on at around about 5 o'clock in the afternoon. When I came out of the operation, when I was in recovery, when I first woke up, I had very strong pain in the right ankle. I felt like someone was sticking a hot poker deep into my ankle. It was a deep aching throb. So the first thing that you've got to do, the first stage, I guess, is the pain management. So the latest theory with pain management is right at the outset. So when you're in recovery and you first wake up, right at the outset you hit it really hard with really strong painkillers and get the pain under control. So it's sort of basically training or tricking the brain. So the nurse asked me, she said, "Scott, are you in pain?" And I said, "Yes, a lot." So she gave me a jab of morphine straight into the thigh, and honestly within 45 seconds to a minute it was gone. Completely gone, no pain at all. I then get back to my room in the ward, and they've got me on Panadol or paracetamol as a baseline pain reliever. That 1,000 milligrams every 6 hours, I think it was. So I was on the paracetamol constantly, but then there were 2 very strong painkillers that were also prescribed to me. One called tramadol and one called oxycodone. Now, both these are very strong. They're narcotics or opiates, or I can't remember. So there were periods there where the pain would start building, so I'd hit it straight away with tramadol and oxycodone, so sometimes both together, and they were incredibly effective. It would just disappear. Pain would just go. So the idea is you just do that and just keep that pain under control. I found after the 2 days in hospital, taking the tramadol and the oxycodone sort of spasmodically when I needed it, and then for the first 3 days at home, after discharge, I was also taking tramadol and oxycodone. So by about 5 or 6 days after the accident, I was just down to Panadol, and that was controlling the pain fine. And only maybe another week and a half taking Panadol, and then I was able to drop that. So the pain has not really been an issue. I've been able to sleep okay. It hasn't been particularly uncomfortable. It's really been no issue at all. So basically don't be a hero, don't try to tough it out because you're only going to make it really hard for yourself. Just take those strong painkillers and get it under control, and if you do that, you'll be fine. So there's really 3 stages post-operation. The first stage, when you come out, you know, when you're in recovery and you get back into your room, the first stage is you're going to have an enormous plaster cast on your lower leg, and that remains on there for 2 weeks. This plaster cast is quite large, and it will go from just below your knee right down to your toes. Totally immobilises the joint. The plaster cast is a bit unusual in that it's open at the front, so it's got a gap of probably 40-50 millimetres at the front, and so it's like wrapped around the leg and the ankle with the slot at the front that's open, and then it's very tightly bandaged all the way down, so that sort of pulls it together. Now I suspect that as some of the swelling reduces, the tight bandaging will sort of pull that cast in. So that cast will remain on your leg for 2 weeks. Just a short interruption here. Here's a photograph of the plaster cast. Now this isn't my leg, it's a child's leg, because unfortunately I didn't take a photo of my own cast, but this is identical to the one that I had on, and if you look carefully you can see the open section at the front. So they're still quite bulky and quite heavy. Okay, I'm interrupting the video again to show you a few more photographs. So this is a photo I took after the first fiberglass cast was removed, so be prepared for a bit of a shock. The lady told me that sometimes grown men faint when they see the condition of their leg. Now, it looks far worse than it is because you will still have the remnants of the antiseptic solution or paint that the orthopaedic surgeon covers your whole limb with. So it's a red or brownish solution that they totally cover your limb with. Also, you'll see there are black marks around the incision there. The main incision is on the inside of the leg, and it looks like you used an axe to open it up, and that's because there was still a bit of swelling around in my case. But those black marks there, they're not gangrene. What the black marks are the surgeon's ink pen, where he's marked up the limb prior to actually operating. So, you know, he puts dots and lines and things on the limb there, and I guess they mean something to him, you know, cut here, drill there type of thing. So it will look a lot worse than it actually is. In my case, because there was still a bit of swelling around, he took the stitches out and then said, come back in a week and we'll cut a window in the fiberglass cast and actually inspect the wound again just to make sure everything's okay. So a week later I went back, they had a look at the wound and it looked really good, you know, it looked so much better. So just be prepared for a bit of a shock when you first see it, and just realise that it's a lot better than what it looks. So after the stitches came out, the lady then put on the blue fiberglass cast. So they wrapped or bandaged the leg first, and then wrapped the polyester cloth over that to create the fiberglass. And then they replace it with a fiberglass cast, which is a much lighter cast. However, it's still quite bulky. Now, unfortunately, because it's on the right leg, I'm not allowed to drive, so I haven't driven, you know, at all. The plaster cast stage, the fiberglass cast stage is for 4 weeks. So you've got a total of 6 weeks post-operation wearing a cast. I'm now just over 3 weeks into the fiberglass cast stage, so I'm just over 5 weeks post-operation. Now, all through this period, no weight bearing. The surgeons really drum that into you, no weight bearing. Now during these stages they take x-rays.
Short interruption. The first photo there is of the baseline x-ray taken during theatre right at the end of my operation.
That's used as a base line, the one after the operation, so they can see where all the plates and screws are. And the surgeon will compare the operation that I had yesterday, which is getting close to 6 weeks after the op. He will compare that with the baseline just to make sure everything's okay and nothing's moved. The other thing that's worth noting with an ORIF procedure on your ankle, the new procedure now is if you have your lower limb immobilised, so if you're in a cast like this, it increases the risk of DVT, that's deep vein thrombosis, which means blood clots. So if you get a blood clot down in your ankle here because the limb's immobilised and the blood pools there, I mean that's very dangerous. A blood clot can break away, it can lodge in your heart or in your brain, and you can have a stroke or a heart attack, and it's potentially fatal. So what I've had to do, and apparently, as I said, it's the latest procedure now, is for 6 weeks while you're immobilised with the plaster cast initially and then the fiberglass cast, you have to give yourself an injection every evening of a drug called Clexane. And this is a blood thinning agent and it takes away the risk of DVT. So that's something you need to know. So every evening you're going to be injecting yourself with a small needle like this. The spear on the needle is 12 millimetres long, and you just inject it into your stomach. What I do is I grab a little bit of the blubber here, and I don't look, and I just stab it in, and it's not too painful. You get used to it after a while. I've got little bruises all over my stomach, but they'll send you out of hospital with, in my case I was sent out with 4 boxes of 10 of these needles. So I've now done about 34 of them, I think, so I've got 5 or 6 left, so I'm looking forward to finishing these, because I don't particularly enjoy doing it. But I guess it's better than having a deep vein thrombosis and ending up with a stroke, so I'm prepared to put up with the inconvenience. I'm unfortunate that I've broken my wrist as well, so I can't use crutches, so I'm stuck in a wheelchair. But if you've just done your ankle only, you will come out with a set of crutches, I would imagine.
And the next photograph was the second x-ray that was taken at the end of the fiberglass cast stage, so that was at the 6-week point.
Well, what a relief that was. I've just come back from the hospital and I've had the fiberglass cast removed, just a couple of days short of 6 weeks. So I'm now fitted with this fantastic looking moon boot. I have to wear this for 4 weeks. Good news is that I'm allowed to do partial weight bearing now with this boot. It really supports the ankle well. So I can actually stand up and put a bit of weight on it. So I'm pretty pleased with that. With this moon boot, I can take it off for when I'm showering. I can take it off when I'm in bed sleeping. I'm allowed to drive the car now. I just take it off, throw it in the passenger seat, and off I go. And obviously, if I'm just lying around, watching television or something, I can also take it off. So it's just such a relief, and it's only 4 weeks to go, and then this is on. So I've got a bit of a montage for you. What's a film without a montage? So here I am in the surgeon's office, ready and waiting for the lady to come and start doing work on the cast. I guess you'd have to say this is the original casting couch. So here she is. She's arrived with the little electric grinder with a cutting disc on it. She cut down both sides of the cast, and then she used a pair of scissors and cut through the cloth, and then just took the 2 halves off. So there's a picture there of the leg, still got a bit of a bandage over the wound, and then she took that off, and you can see
my leg there, it doesn't look very attractive. There's, that hasn't been touched for 6 weeks. So there's just layers of dead skin and there's still a bit of blood and stuff around. And then after that, all she did was put that white sock on and then fit me with the moon boot. And it was my job when I got home to actually, wash the leg. Here I am, I'm back from the doctors and I'm giving my leg a wash, trying to get rid of all the dead skin. So I'm soaking it in warm water and probably give it about 5 minutes or so, and I'm just using a scrubby, I think they call them. But as you can see, there's still a lot of dry blood and stuff around. So I'm just continuing to sort of wipe the leg, just give it a gentle scrub with the scrubby washer, and it's doing a good job. Yeah, it's cleaning up really well now, and I've got a little ceramic scrubber here which I'm using on the bottom of the foot to get all the dead skin off. There's just a layer of dead skin all over because the foot's been immobilised for 6 weeks. I haven't been able to touch it. So this is working really well. You can see the main scar line there, and then there's also another incision on the other side. But I'm really pleased it's come up really well. I've got quite a bit of movement, absolutely no pain, and it feels really good. So I'm wrapped. Hello everyone, I thought I'd give you an update. I'm now 2 weeks into the moon boot stage, so I'm halfway through, because the moon boot is a 4-week stage. So if you remember, it's 2 weeks plaster cast, 4 weeks fiberglass cast, 4 weeks moon boot. So I'm 2 weeks into it. I'm now 8 weeks post-operation and things are going really well. The recovery on the ankle now is going ahead leaps and bounds. I can weight bear, I can actually walk a bit. It's not a major problem to walk if I just walk slowly. I wouldn't want to try to walk 10 kilometres. But that feels pretty good, and I don't really have a limp. What I did find was I have been using one of those compression socks that you use for long haul aeroplane flights. That's been really good, so I've been wearing that quite often, during the day and sometimes at night time. I just thought I'd give you a close-up of the main scar there on the inside of the ankle. Still looks like I've been hit by an axe, but it's healing up quite well. It's the third post-operation x-ray taken just a couple of days before the 10-week mark. Everything looks good, everything's in the right place. There's still a slight crack that hasn't fully healed, so the surgeons asked for another x-ray to be taken in 4 weeks' time. Here's another update for you, a picture of me walking down the driveway. I'm now exactly 10 weeks post-operation, so I was able to get out of the moon boot yesterday, and I'm walking normally. I just can't walk a long distance at the moment, but it's feeling good. Okay, now I'm 12 weeks post-operation and I've been given the go-ahead by the surgeon to start gym work again. So I'm getting back to my normal routine. I was given the go-ahead for lap swimming at 10 weeks, so I've been swimming about 3 times a week. I've found that very, very good for getting the ankle moving. The other thing I've been doing is going down to the beach. We can do some water jogging. That means I go out to around about chest deep and then jog up and down water, combination of movement. The fact that my weight is mostly supported and the cool water has been tremendous rehabilitation coupled with the lap swimming on the ankle. So I've got pretty well full movement of
got very minimal pain, and I can walk further now than I could a few weeks ago. I think the longest walk I've done is about 1.5 k's. So I'm very pleased with the progress. Hello again. Today I'm exactly 14 weeks post-operation. Now I had a meeting with the surgeon 3 days ago. We had another x-ray, everything looks fine. My recovery is going very well. Surgeon's now given me the go-ahead basically to resume normal activities and to let my ankle determine how far I go. Now I pretty well started doing normal things about 3 weeks ago. Around about 10, 11 weeks I started lap swimming, gym training, etc, etc. So I'm quite pleased that the end is near. I can walk quite well. I can walk a reasonable distance. I don't think I could run, so I think if you're a runner, you'd need to wait longer. I just couldn't see it working trying to run or jog at the moment. It'd just be too painful and too severe. So as far as my normal activities though, doing projects on the house and the car and the bikes and things, so just to summarise, I think the first 6 to 8 weeks are the most difficult. While you're in a cast, that starts getting you down a bit. I was getting a bit of cabin fever, I think. Once you get past that sort of 6 to 8 week mark, I found that things started improving quite rapidly. It was noticeable almost day by day. Things were just getting better and better. So if you can persevere for that first 6 to 8 weeks and don't do any weight bearing, I think that's very important. Once you got past that, trust me, it gets easier fairly quickly. The surgeon said to me I could probably get back on my track bike in about 4 to 5 weeks. I feel as though that's probably a bit too soon. I think I'll delay that probably to more like 6 to 8 weeks before I get back on the bike. It's a pretty severe strain on the ankle once you get on the track bike when you're moving around on the bike and throwing it from side to side. So I'm going to make sure I'm 100% before I put myself at risk on the track. So this is the final instalment, and I hope that my story is of some benefit or of some help to you if you end up in the same situation with a broken ankle and you need ORIF. But remember, this is just my story, it's different for everybody, and you'll need to take the advice and the counsel of your doctor and your surgeon and your medical professionals. So thanks very much for watching.